So I want to start off by telling you the new cases that we have for today. There are 11 new positives so far today, to a total of 64. As we are seeing increasing numbers, and the challenge and the time it takes for the investigations, we won't be able to give you as much details on each individual, but we will make sure that you have the information that you need to understand what is happening as this pandemic progresses. So with respect to that, we now have an additional outbreak or a cluster of cases in a facility in the Vancouver coastal region. So as they announced earlier today, there are 3 administrative staff at Lionsgate Hospital who have tested positive, and obviously the investigation is ongoing to make sure we understand where they got this, and also to ensure that the rest of the hospital is safe. They are not people who had patient contact, and there are measures been taken at Lionsgate Hospital to ensure that everything can be done as safe as possible there. We also have an additional case related to the Lynn Valley Care Centre. It's a close contact of one of the healthcare workers who was identified earlier. And we have 5 more travel-related cases. And it's a reflection of what we discussed yesterday, the increasing risk in countries around the world, that we continue to have people who come in from those countries. And now we have the additional ones that we know of from today are from Iran, Egypt again, as well a tour and a cruise on the Nile, the Philippines, and Mexico. And these are areas that are more newly identified as having issues with transmission in communities in those areas. 2 cases are still under investigation, and I don't have details on them yet. All of the cases from today are in the Vancouver Coastal Health Region. In terms of the existing cases, we have 2 people who are hospitalized now. One we talked about yesterday, and somebody who was newly hospitalized last night. 6 have recovered, and the rest are in isolation at home and are being supported by public health teams. Did want to talk a little bit about some of the measures that we introduced yesterday, in particular the advice against all non-essential travel outside of Canada. And people have been asking about why outside of Canada, and particularly we know a lot about what is happening within Canada, and it is still safer, though, as we understand, across the country we are starting to see increased numbers of cases, and it's a reflection of how we are part of a global community and a global pandemic. And we also need to talk a little bit about essential. And so, as I mentioned yesterday, we felt it really important that we get the message out, particularly as many of the schools are starting March break as of today. So we wanted people to be forewarned about these issues. And we know that the Government of Canada has now put a travel advisory that's very similar to ours, and the requirement for people to self-isolate on return. So we have deemed essential people who are involved in the movement of goods and people across our international borders. So we are not including long-haul truckers, for example, people who bring manufacturing goods into and out of the country, flight crews, etc. And we've had some discussions about that today, and we'll have provided and we'll be providing more specific guidance to industry. But the important thing is not that they're free and clear, but we do know these are risky, and these are risky travels. And so air crew, for example, people who truck back and forth across the border, they need to have an active monitoring program, self-monitoring. They need to have access to the ability to clean their hands regularly, enhanced infection control on trucks, on ferries, on airplanes, and those are all measures that are being put in place. And they need to be supported to check themselves daily for symptoms when they come back, and stay away from others, stay away from mass gatherings during that period of time. Having said that, there are many things we can do. We're not talking about shutting down society here. It's still very safe today in BC, all across BC, to go out, to go shopping, to go to restaurants, and in particular, we have a lot of things that we can do outdoors, which are very safe things to do. This virus does not transmit when people are outdoors. So go outside and play with your family. Go up to our ski hills. Go up to Whistler. Go out and experience what we have here in British Columbia right now. In terms of public gatherings, I've talked about yesterday making it not allowing gatherings over 250 people, and the rationale is based on practicalities, not science, but it's a number that we can work with to ensure that distancing measures are put in place. I am saying that today I'm going to make a provincial health officer order to make that mandatory, and I understand from the investigation that we've done into this that allows people to trigger insurance and other things for events that have to be cancelled because of this direction. So we're going to do that as well. So really, I think it was a bit of a shock for people, and we talked yesterday about how this was such a rapidly evolving situation over the 24 hours leading up until yesterday. And now that we're getting into the details and we're realizing that these are important things for us to do, and the reason why they're important is because we need to stop and slow the spread of this virus in our communities here in BC, to buy us the time to ensure that we can flatten that curve and protect the most vulnerable people in our society, the people who are in our communities who are more likely to have severe illness or to die from this virus, and to allow our health system to be able to build up and count and accommodate people both who have this virus and safely look after everybody else who needs health care in our system. So this is the time where we all need to do our part. We need to stay away from others when we're sick in particular. We need to cover our mouth when we cough. We need to clean our hands regularly. We need to enhance our cleaning in our environment. And these are the things that we do to protect ourselves from getting ill, but also we know that this virus is most likely to be spread to the people who are closest to us. So we need to do this to protect our families and our close friends and our communities. And not everybody who comes back from travel and gets sick needs to have a test. And we'll be providing some more guidance to support people if they have an illness, mild illness, that doesn't require you to seek medical care, to support themselves at home. And we've been tested on our testing in the last little while, and we now, and I've said this before, for people who don't have any travel history, for people who have milder illness, we need to prioritize the people who need to have a COVID-19 test, and you may not need to have a test. We clearly do not need to have tests for people who have no symptoms. So if you've come back from travel and you've gone through your 14 days and you've not got sick, there is no need for a test. And so employers, I know we've had questions, why can't we just test everybody, and you need to have a test before you're safe to come back. This test is not necessarily valid for somebody who is not sick. So there's no reason to test anybody who's not sick. And there's no reason to require a note for people who've been off. We don't want people to have to go see a practitioner, a medical practitioner, if they've been off on quarantine because they've been traveling or for other reasons. So we are requesting people not to request physician notes for people to be deemed safe to come back to work, and no, you don't need a test either. So we can do things to stop the spread of this virus in our communities. It is not inevitable that we are going to have a major surge in a short period of time, but those are the things that we need to do now to protect our communities, to protect our families, to protect our seniors and elders. And I'm calling on everybody in BC to work with us to do that.
There's no cost to test in British Columbia, nor will there be ever. for COVID-19. I wanted to note that we are starting to build out that network of testing facilities, and we'll have more to say about that over the weekend. I think what's important in that is to note that that is somewhere people will go for referral so that they can address things more safely. It's not a place for people to go without referral or without recommendation. I want you to know that as part of that, or part of our work with the doctors of BC to improve that, we're working, in fact, meeting as we speak. The Deputy Minister of Health and others are meeting with the General Practice Services Committee on this, working together to see how we can improve things, how we can improve referrals, and how we can allow doctors to make referrals and make assessments more simply, both sometimes in person but safely, and sometimes at a distance. Yesterday, we had a number of requests for information about different health equipment, and so I'm going to read off some information as requested yesterday. Number of acute care beds by health authority, 1,447 in Interior, 2,577 in Fraser Health, 1,928 in Vancouver Coastal Health, 1,770 in Island Health, 571 in Northern Health, 309 at the Provincial Health Services Authority, that's Children's and Women's. We were also requested information around ventilators, and in addition, I should say, extra ventilators are being ordered by the province, and we'll announce them upon arrival so that we're telling you when things actually arrive, when things actually open, not what we've requested. And the number of ventilators in the Interior Health is 229, in Fraser Health is 409, in Vancouver Coastal Health is 216, in Island Health is 155, in Northern Health is 116, and in the PHSA, that's the Provincial Health Services Authority, there's 147 for a total of 1,272. I'll give you a further breakdown on that. Critical care surgical ventilators used in the hospital are 956. There are transport ventilators, 164. Home ventilators used to manage chronic patients in their homes, 120. And there is a 4 specialized machine, the ECMO, and there are 32 of these machines which pump and oxygenate a person's blood outside of their body. I just wanted to say, so that's the information we requested yesterday, and as I said, we're happy to respond to requests for information as was made by a number of reporters yesterday. I wanted to say a couple more things just about 811, that we have done in the last 3 days more than 10,000 calls, completed calls on 811. We understand that there is significant pressure and lots of people have trouble getting through, but I think the main message we're saying today and every day is that if you're sick, stay home and help yourself get well and be patient with these services. 811 has done an unbelievable job in the last week, essentially tripling the number of people that it talks to every single day. That's an incredible addition in service, and we're going to continue to work to see that that happens in addition to bringing in more nurses and so on, and we're going to provide more information about additional numbers people will be able to come to relieve some of the pressure on 811 in the coming days. And so I want to just say in conclusion that all of this is to say that we know what we're facing here in British Columbia. We are part, and we're dealing with our element of a global pandemic, and that is going to challenge us and put tests on us. And I think the response, if you look at the response of the BC CDC to date, the response of Dr. Henry and her team, the response of health authorities has been extraordinary in expanding service. But we're going to be tested in the coming days as well. Currently, we have, I believe it's 2 people, Dr. Henry, in acute care today, 2 people in acute care with COVID-19. We know that that number will grow over time as the number of cases grow. And it tells us, that we have to focus and are focusing that care right now in the community. Things such as 811, things such as providing better access to care and testing and information in the community. And finally, we're all part of this. And if we want to push the curve along, as has been said, if we want to avoid a spike, we're all part of it. And so when we ask people not to travel outside of Canada, that's playing our part. When we ask people to stay home when they're sick, that's playing your part. When we ask people to wash their hands regularly and I'm between 40 and 50 today, I think, myself. That's playing a part. We ask you to throw away Kleenexes and not touch your face. That's playing a part. When we ask you to support other people in the community, that's playing a part. All of these things, we have agency here to help one another, to assist one another, to protect one another as a society, as a community, as a place. This is happening in the world, and it's coming towards us. And we have been dealing with it, I think, very well up to now. But the challenge is in the next 4 weeks dwarf the challenges in the last 4 weeks. And how we'll deal with that best is to deal with it, and for everybody in British Columbia to play their part. Thank you, and we're happy to take questions.
Thank you, Mr. Dix. And before we launch into the Q&A segment of the event, I would like to let the media know that the government is launching a Joint Information Coordination Center, or JIC, to manage COVID-19 communications across government. And perhaps media may already be receiving some correspondence from members of the government's JIC team. Government will also have phone lines available for the media in the very near future. In the meantime, please continue to contact specific ministries with any media requests, and the JIC will work closely with each ministry to respond to your request. And we're changing the format of the daily presses a little bit. We request the media to ask just one question so that we can accommodate a large number of questions. We will take questions from the room first and then go over to the phones. Time permitting, we will be able to take seconds, but for now, I request the media to please ask one question each. We'll take questions from the room first. Do you, any questions here? CBC, go ahead.
Hi, Andrea Ross, CBC News. Can you hear me? Andrea with CBC News. We're hearing that urgent care centers like the one on Hornby Street are overwhelmed with people who are wanting to be tested. What is being done to ease the pressure, reduce wait times, and keep staff safe as well?
Yeah, so these are some of the initiatives that we're working on, and part of it is people to understand that not everybody needs to be tested for this. We know that it's not spreading widely in our community yet, and at some point, if it is spreading quite widely, we won't be testing most people. We'll only be testing people who are in hospital or where there's a cluster or where there's an outbreak potential, so that we're able to manage those effectively. And the advice for everybody is, if you're sick, stay home. There's care guides for how to look after yourself if you're sick at home, how to look after your family, and when to seek care if you start to get worse. So I know Vancouver Coastal, I know actually across the province, they're working to try and manage some of these issues. They've done a tremendous job at the UPCCs, and in particular that one, and they've arranged things so that the personal protective equipment is available in those sites, and that people are coming in at various times when there's not other people there. So it's a lot of logistics to try and support that, and to make sure that only people who are prioritized and need to be tested are able to do that safely and quickly.
And just to say, in the case of the Seymour Medical Clinic, who are our partners in these, both in North Vancouver and in Vancouver, that the team there has done an outstanding job. It's a challenging circumstance. What we're trying to do is to provide ways, by working with doctors all over BC, trying to find ways to improve the situation. I'd also note that we've had a very positive response. We've asked people who are recent retirees, both as doctors and nurses, if they're prepared to come back, and we'll report on this with details later, but we've had to date an excellent response, and it shows, I think, the commitment of the medical community to people here. So we're doing work right now with the doctors on all of these issues, from how we'll be able to deal with more people remotely, how we'll be able to deal with people on sites, and facilitate testing for those who ought to be tested. But just so everybody understands, when we open such sites, or if we were to open such sites, it's not for people to go if they haven't been referred there by anyone. We have to have tests for people who need tests, and those decisions will be made by medical professionals.
Thank you. Next question.
Hi, I'm Sam Fenn with Crackdown Podcast. Our editorial board is made up of people who use drugs on the downtown east side, many of whom are immunocompromised. Our board members have to go to the pharmacy every day because of restrictions not allowing them to get methadone carries. Others top up in the black market. We don't understand how they are supposed to socially isolate. Will you change the rules around opiate agonist therapy to allow people to have carries and carry a supply with them more than one day? And will you give our editorial board members and the other vulnerable people in Vancouver a safe supply of drugs? Thank you.
Yeah. You know my views on safer supply, pharmaceutical alternatives to street drugs, and I'm obviously very much a supporter for that, and I know we have a number of initiatives ongoing that we want to increase. I will also say that we are actively working with organizations in the downtown east side in particular, but in other communities as well, to support means and ways of protecting people from this virus, but also allowing them to not have to congregate in certain ways, including ways to safely provide them with the medications they need. Absolutely. I don't have the details.
On the methadone carries?
That's one of the things that we're looking at.
Yeah, and if you remember, as we did the plan last week, I mean, one of the challenges up to now is this has been the COVID-19 cases have been largely linked, not exclusively linked, to international travel. And that's a different community, obviously, than people who are struggling with addiction issues of all kinds. But there are a lot of vulnerable communities. We've seen seniors in care and other communities, and that's the key focus of what we have to do now in this phase should the virus become more generally distributed to people around BC.
Next question.
Hi, I'm Gaz from CTV. Question is, other provinces are opening standalone dedicated testing clinics. In Ottawa, one opened in Hockey Arena today. Some clinics are doing drive-through tests. What are we doing?
We have a variety of different models that are being designed for different communities. So we have, as I've mentioned before, done the drive-through thing in some areas. We are looking at, I was at a meeting today where we've been talking about some of the strategies that we can use in different places, and it's a challenge. We've had methods that have worked really well in some communities, and in the last couple of days, many of them have been whelmed, if not overwhelmed. So we need to address new strategies, and we need to focus and make sure we can prioritize the people who need to get tested. And I mentioned that we get I've been getting quite a lot of complaints from employers that want somebody to be tested who's not sick before they'll let them back to work. So we need to disabuse people of that notion that that is of any value at all. So.
Yeah. And just to start, I mean, we believe we do have some in operation, including one in Victoria today. We're not going to tell you what the plans are. We want to open them rather than say we're going to open them. So once they're open, we'll be briefing here about the details of those things. But yes, let me say first of all that we've done more testing by, I think, a significant margin than any other jurisdiction within the existing circumstances we face, and I think you've seen that. The numbers demonstrate that. We tested well over 4,300 additional cases this week after having done more in the previous 5 weeks as well at 2008. So we are succeeding in getting a lot done. And but as you point out, there's some pressures in that in some primary care providers, and so we're going to address that in different ways in different health authorities, but all of the ideas are on the table that you've heard elsewhere. And once they're in place, of course, we'll announce them, but only when they're in place.
Thank you. Next question, Radio Canada.
Mugali Samba, Radio-Canada. I'll be asking in English and maybe a French statement afterwards. There are a lot of British Columbians who are abroad right now. What is the recommendation for them? Should they return? And if so, how should they plan their travel?
Yeah, so we are asking everybody who's abroad or is going abroad outside of Canada to self-isolate for 14 days on their return. We do recognize that there are some essential workers, and we've made some provisions with individual groups. For example, we know that there's healthcare workers that if we had everybody who was off not be able to come back to work would leave us in dire straits. So we've made some provisions for safely coming back to work in certain circumstances for people who provide direct patient care, but we are requiring them to actively self-monitor and then to be in isolation at home, not to go out and about in the community doing their business like everybody else. So those things will be in place for critical workers in the community as well. But we're working through the details of that. But the bottom line is we're asking everybody to come back to self-isolate.
Thank you. Next question.
Et puis seulement en français parce qu'on veut quelques remarques en français en général, c'est que nous avons 11 cas de plus aujourd'hui, c'est-à-dire vendredi, ça fait 64 cas un peu partout en Colombie-Britannique. La grande majorité maintenant sont dans la région de Vancouver, la région de santé de Vancouver Coastal Health. On a fait et nous avons des nouvelles chiffres pour les tests en Colombie-Britannique. On a fait pour les individus, on a 6326 tests qui ont été faits. La semaine dernière, cela a été 2008 tests, c'est-à-dire que c'est une augmentation de 4318, ce qui est quand même extraordinaire et je félicite et j'admire beaucoup le travail de tout le monde au BCDC qui a fait ce travail extraordinaire. Donc, on a eu beaucoup de succès là-dessus, mais il faut en faire plus. Je le reconnais, nous le reconnaissons et nous sommes en train de travailler là-dessus.
Est-ce qu'on peut juste avoir la réponse des Français colombiens qui sont à l'étranger?
Oui, effectivement. Nous voulons que les gens restent isolés pendant 14 jours après leur retour en Colombie-Britannique. C'est fait pour tout le monde, de tous les endroits. On a parlé auparavant de l'Iran ou de gens qui reviennent de la Chine, mais c'est un appel général maintenant, c'est un conseil général et c'est l'obligation civique de tout le monde de suivre cet avis.
Thank you. Next question, Vancouver Sun.
I was wondering about the funding. What sort of guidelines you have gotten from the federal government, and also if there is an emergency since the Parliament seems to be suspended for a while, how are you going to get that funding if there's an emergency that you really need that?
Well, as you know, first of all, the federal government has offered its support to us as part of its $1 billion plan, which has a number of elements, but one of those elements is providing support for provinces. Clearly, British Columbia and Ontario and Quebec are the three provinces with the most cases, although Alberta has quite a few now. And so what the Government of Canada has said is those provinces that need the resources the most will get some. As a government, we haven't put any financial restrictions on our need to address this question. It's a question that is required for everybody. So we are providing the resources that are needed to deal with this because, in fact, the more we're able to push the situation into the future, the more we're able to protect people, the less the financial implications will be. So all of that money, all of the money we spend on testing, on resources, on bringing doctors and nurses back, on ensuring that people are safe, supporting them in their homes, supporting them in their communities, all that is money well spent.
Thank you. And we'll take one last question from the room before we move to the phones, and that's CP.
Thank you. I appreciate it. Yeah, I'm Brenna with Canadian Press. I'm actually just wondering about how concerned you may be about folks who might be asymptomatic, people who are displaying minimal symptoms, and just given the escalating numbers.
Yeah, so we still have a relatively small number, and if we look at, which I have, and the people that I work with are watching very carefully, particularly those countries that have a lot of cases, so China, Korea, Italy now, and it really shows that asymptomatic spread is tiny. It's not what is driving this outbreak around the world. It is when people have symptoms and when they're close to people and when they're coughing and when they're sneezing and when they have fever. That's when you're most infectious. Having said that, we do know that early on people may not recognize their symptoms, and particularly young healthy people may not realize that they're feeling unwell. And that's why we've been emphasizing any symptoms, even if it's just that I feel like I'm fighting off something, that tiredness, that fatigue. That means that you need to get away from others, self-isolate, let your body heal, see what happens. And so it's really, really important that we start that early.
Thank you. We'll go over to the phones now. And another request, please, one question each. We have a lot of media lined up on the phones. And the first question is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, what is your advice to snowbirds who are currently out of the country, out of British Columbia? Should they return back home to British Columbia earlier than planned?
Yeah, that's a very good question. And, we've been saying all along that this is evolving very quickly, and people need to judge their own risk about being caught up in quarantines. And now it's a quarantine here. And so people need to understand the risk in the place that they are. And many snowbirds in parts of the U.S. may be in places that are not having a lot of this. So if they do come back, if people do come back home, then across the country now, they'll be asked to self-isolate when they get home, and we'll need to monitor them carefully because we know the risk in the United States is also very variable and is moving.
Thank you. Next question, Shannon Patterson, CTV.
Hi, Dr. Henry and Minister Dix. So if 811 decides a test is needed, if somebody calls, they meet the criteria, where are people being sent for that test? Is it urgent care centers or is it still hospitals? And if we do open standalone clinics like they are in Ontario, that one in Ottawa today, are you concerned about a lack of supplies? Because we're hearing from doctors that masks are running so low, they don't have the right supplies. So you'd think a standalone clinic, they would need a lot of supplies.
Yeah, so a couple of things. One, we have always been directing people to community to get their testing, not to hospitals. And we've actually very successfully done most of the tests in various places in the community. So 811 does refer people to clinics, to the urgent primary care centers. It depends on where authorities has identified the areas and the people and the practices that will provide these testing. Where the challenge has been is providing supplies to across the board, and that's why we're becoming more focused now. And there's some assessment centers, there's some the urgent primary care centers. Some of them are in standalone places in public health centers, for example, and sometimes we actually send people in their cars to parking lots, and a nurse will go out and test them. So that allows us to make sure that that the places that are doing the testing have the appropriate supplies. And we have not had a shortage in the key areas. There has been a challenge in providing all primary care providers with the PPE that is necessary and that they need in their offices, and that's been a supply challenge around the world. So that's why we're focusing on specific areas that people can be referred to.
And those are exactly the issues that we've been working on with doctors in various forums this week to make sure that A, and because this is very important, that they're safe and protected, and B, that we can provide the maximum service. But I would say that the numbers tell a story of a system that's produced a lot of tests, and that reflects the extraordinary work at now 5 sites in terms of processing the tests around British Columbia, especially led by the BC-CDC, and then by the work of primary care providers around the province. Has really been exceptional when you consider all of the issues involved and the amount of testing that's taken place in this province. But we know that we have to support people even more, and that's why there are going to be even more options for that in the coming week.
Especially as testing increases. I just did want to say there was some concerns about the swab being in short supply across the country, and we've been working on that, and we believe we have a solution for that. It's not been an issue here, and it's not been an issue yet. We're getting close, but we think we have a solution for that, so that's good news, and hopefully will be used across the country.
Thank you. Angela Junk.
Now that everyone who's coming back to Canada is being asked to self-isolate, what are some of the best practices, especially for people who live in apartment buildings? Should they avoid shared laundry suites? So what exactly does self-isolation look like?
Yeah, so self-isolation means staying in, monitoring yourself for symptoms. You can go out in areas where there's not other people around, avoiding mass gatherings, avoiding going out to communal areas with people. And yes, if you need to do your laundry, that's fine, as long as you're not having any symptoms. So it's being very careful about how you interact with others. Try and go at a time when nobody else is there. If other people are there, go back and come another time. There's guidance that we have about how to do this effectively on the BC CDC website, and we have some details about what to do. But the big thing is to limit your interaction with others during that period of risk. And there's many things that we now have that allow us to get medications online, to get people to drop off food, and communities have been coming together to support people in that. And that's what we need to do now, all of us, because it protects all of us. And we don't have a treatment for this. We don't have a vaccine for this virus. So the best that we can do is keeping people away from others during that incubation period. And that's why the 14 days period is so important. We want people to stay away from others. So as soon as they develop symptoms, they're not passing it on to anybody else. And we can break those, I say it again, we can break those chains of transmission so that they're not passing it on to somebody else. And that's the best that we can do right now. And that we all need to do it collectively. And it's the way that we keep each other safe.
Thank you. Next question, Mike Hager, Globe and Mail. Go ahead, please.
Hi there. Wanted to know, has Vancouver Coastal Health done anything to reinforce staffing of care aides at Lynn Valley Care Center since the outbreak there? And has the precarious nature of the jobs in many nursing homes exacerbated the risks because staff often work across several facilities, sometimes in the same day?
Yes, and that is something that we're very aware of and has been a large part of the outbreak investigation and the concerns that we have. And we know that the two care home outbreaks that we have in Hollyburn and in the Lynn Valley Care Center, that staff were working in both of those areas. And we know that the contracting out of services means that people can work in multiple different ones. In terms of dealing with these two outbreaks, people are restricted to working in those facilities only, and we've put in provisions, or Vancouver Coastal has put in provisions to support healthcare workers in those two facilities and to ensure that that doesn't leave other facilities that are relying on those workers as well in the lurch. So it's been a lot of human resource juggling and ensuring that we can do that. And I will say we're looking at a broader strategy, particularly in the care homes that we have, because we know that once it gets into a long-term care facility, it can be a very challenging virus. It can make people who are elderly very severely ill, and we want to do our best to protect our long-term care homes. So we need to look at a strategy, at least for the next while, to try and better protect them, and that could include looking at how we manage staffing for each of the care homes and not having as much transmission of staff between them.
Thank you. Next question, Cindy Harnett, Times columnist.
Hello, Dr. Henry. You were talking, reassuring people about being able to go shopping and to enjoy restaurants and outdoor activities. I'm seeing conflicting studies now about how long the virus lives on hard surfaces, stainless steel, plastics, that sort of thing. Do you mind going over the science of that, of how long the virus lives in different conditions?
Yeah, so this is a droplet respiratory virus, which means it's in the saliva that we breathe out, and it can last on surfaces, and depending on humidity and temperature and sunlight is a very effective, UV light is actually quite effective at killing this virus. It can last on surfaces for hours, sometimes maybe days. That's why it's so important that we enhance our cleaning. It's very susceptible to all of our regular household cleaning products, and if we don't have our regular household cleaning products, a 1 in 10 bleach solution works very effectively as well. And it's also why it's so important to clean our hands. And we don't get infected by touching the virus. So if we're on the bus and somebody is coughing and there's gunk that we get on our hands from touching something that has been contaminated, that is not how we get infected. We get infected by taking that and touching our face and eyes and inoculating ourselves. So that's why we talk about how important it is to clean our hands regularly. And particularly when you're out and about, if you're in high-touch areas, then you want to make sure you have alcohol hand sanitizer with you, or you hit the sink with the soap and water. And soap and water, plain soap and water, is the best thing that we can do to remove the germs from our hands. So that's the really important piece about it, and we've been working with businesses, we've been talking about this with transit, with BC Ferries, enhancing the cleaning that we do, the routine cleaning in those high-touch areas, the places where lots of people are, because that also kills this virus and gets it off those surfaces.
Thank you. Next question, Amanda Follett, Tai. Go ahead. Amanda, are you there? Okay, next question, Marcella Bernardo, News 1130.
Hi there. I'm hoping to ask about, we've been hearing reports that we're going to have some drive-through testing centers. Can somebody clarify about when that might happen, if it might happen over the weekend, or how soon can we actually see this?
Well, we're looking, Marcella, at a number of options to have testing centers around the province. And we'll be, once we're ready to go and they're established, we're going to let people know. I think what we've tried to do consistently is say, here's a service that's in place, and it's in place here and now, or will be in place on this date at this time. And so when we're ready to make announcements, you'll be amongst the first 100 reporters to know.
Thank you. Next question, Jane Side, North Shore News.
Yes, hello, Dr. Henry. I am wondering, the outbreak in two care homes here on the North Shore has people asking a lot of questions. So I guess I'm wondering if you are actively looking at the possibility that there are other care homes here on the North Shore that may have been affected, and also whether you have any idea how this would spread by the workers between these facilities, especially if people were hand washing and disinfecting properly. How did that happen?
Yeah, very good question. And these are absolutely paramount for us in the investigations. And I have to say the team at Vancouver Coastal Health has been on site. The public health team has been doing detailed investigations and tracing back who touched who when, so we can find out exactly how it was introduced into Lynn Valley and Hollyburn and which one came first. You know, those are the things that are challenging to understand. Is it related to travel? And we don't have the definitive answer yet, but it's becoming clearer, and it's becoming clearer how people may have transmitted to each other. So we know that this is transmitted through close contact, and we know that workers have close contact with each other. They also have close contact with the residents. And prior to the outbreak being recognized, there was not people who were not wearing masks and things like that in the care home, as is the usual. So we do have really sensitive protocols for identifying when there's an outbreak in a care home, a respiratory outbreak, and we have been investigating all of the care homes in the Lower Mainland, and Fraser Health and Vancouver Coastal have been messaging to all of them. We put in measures to reduce the number of people going in and out of long-term care homes in the Lower Mainland, to make sure that you're only going to see your family member, to clean your hands, to not come in when you're sick, and that's the really, really important part. But yes, the detailed investigation of every single staff member and where they worked and making sure that that care home is protected is the first order of business in the outbreak protocol.
Thank you. Next question, Mike Howell, Vancouver Courier.
Yeah, hi, good afternoon, Dr. Henry, Minister Dix. I heard today that the federal government is going to restrict some of the airports that people can land at who are abroad. Have you heard anything more from the federal government on that, and what that looks like in terms of a provincial role when a plane lands in British Columbia?
Well, we will be hearing more from the federal government. As you know, the Prime Minister and premiers met today by teleconference, and I think we'll be hearing more on that issue in the near future. It would be, of course, our expectation inevitably that one of those airports would be YVR in any event.
And we are engaged always with YVR, so the Canadian Border Service Agency and the Public Health Agency Quarantine Service are based there, and we have an ongoing relationship with them. So when we know which airports are involved, we'll make sure that the protocols are in place to identify anybody who's sick and make sure they're assessed appropriately.
Thank you. Next question, Graham Wood, Glacier Media. Please go ahead.
Hi, as it relates to transmission, it's being announced by Hockey Canada and BC Hockey today that hockey is canceled. They claim to have consulted with public health officials, but of course here in BC, rec leagues, beer leagues in BC continue to operate under your guidelines. Are you aware of what advice BC Hockey was given Is this evidence of an overabundance of caution or an unbalanced approach? Or do you think recreation facilities are on the verge of closure?
I'm sorry, you broke up a little bit, but I think what you're asking is, what advice was BC Hockey given around the interventions that are appropriate? And I have to say that I'm actually incredibly disappointed that the NHL was canceled because I had tickets for Tampa Bay on Wednesday, but I think it's the right thing to do, and it was the appropriate thing to do. So what we've provided advice is around gatherings that have more than 250 people, and it's not talking about day-to-day things. We're talking about one-time events or events that happen periodically. So there are ways that the hockey teams and players can continue to play. There's events, there's games that can still happen, but they need to be done with appropriate precautions in place. And same with gyms, same with recreation centers. So you want to make sure that you have space between people. You want to enhance cleaning. You want to make sure there's availability of hand hygiene or soap and water for people to use on a regular basis. You want to make sure there's signage and that people don't come in if they're sick, and that you allow for people to cancel out or to not come in if they're not feeling well. And then within teams, there's things that are important to do, like not sharing of water bottles, not having that close contact in the locker room, and in ways that you can do that safely. So that's the advice that we've been given. If people feel that they can't do it within their setting, then they may make the decision to close down or defer things.
Thank you. Next question is from Arthur Williams, Prince George citizen. Please go ahead.
Yes. There hasn't been a detected case in Northern Health yet, but I was hoping to get some sense of, has there been any active testing done in the NHA area? Is there, and does, do some of these rural northern communities have the infrastructure to even handle and administer a test if someone in their community gets sick?
Yes, there has been testing in a number of areas in the north. You're right, there's not been as much people who've been at risk from travel or other contacts. There have been a number of people who have been under observation in self-isolation because they had been in contact or had traveled to an area that had been a high-risk area. So we do know that they're watching carefully there, that we're also testing from the north for people who've getting a test for influenza, for example. They are looking at, how do we support smaller communities where the testing volume is not that great. And really our focus in planning has been, how do we ensure that we keep people who might be at risk of having this virus outside of many of our small communities or remote communities, or communities that don't have a lot of healthcare support, or in our Indigenous and First Nations communities around the province where we know that there may be a higher proportion of people who are elderly or people who have underlying chronic conditions. So that's been part of our focus as well. And I think these measures that we're talking about around travel, around self-isolation, around doing the things in our community to best protect our seniors and elders are really important in the north, and as they are everywhere.
And just to say, the Northern Health Authority has its own Emergencies Operations Center there, and they're making their plans. And the First Nations Health Authority, which is also very active in the region, is fully integrated into those plans as well.
Thank you. And one last question from the phone. It goes to Phil McLaughlin, Black Press. Please go ahead.
A published report in the Okanagan states that upwards of 5,800 people will die in the Okanagan. I'm just wondering if the province is aware of this, and
Well, I think if we look at the number of people who've died around the world and the number of infections, that doesn't ring true to me. So people may have been doing some blue sky back of the envelope estimations based on things like we talked about yesterday, on some of the models that are based on the early phase in Wuhan, for example, where there was a rapid increase in people being infected. But even then, once you put in measures that slow things down, drag things out, make sure that we do our our best at prevention and detecting cases and clusters and preventing spread from people we know have the disease, we can affect that so that we don't see those types of numbers. And we are absolutely committed to doing that.